Hi everyone and welcome to the Health Boardroom. I'm Ron and I'm glad you're here today. This is where we explore the forces shaping the future of healthcare, from policy and innovation to leadership and patient experience. Today, we're diving into a question that every healthcare leader should be asking. How is technology reshaping the patient experience? And what can we learn from industries like retail and aviation that have already mastered customer engagement at scale? For decades, healthcare has been about transactions, appointments, treatments, discharge plans. But in almost every other industry, technology has transformed transactions into relationships. Retail knows who you are, what you like, and what you might need next, long before you click buy. Airlines know your travel plans, anticipate delays, and send real time updates before you even look up from your phone. Now, just imagine if healthcare could do that. Not just react to illness, but anticipate it. Not just provide care, but design experiences that feel personal, connected, and seamless. That's the transformation already underway. From smart scheduling systems that match patients with the right provider to AI powered chatbots answering medical questions 24/7. Technology is quietly rewriting what it means to be a patient. And here's the key insight for you. People no longer compare their healthcare experience to their last doctor's visit. They compare it to Amazon, Delta, or Apple. That shift in expectations is forcing healthcare to evolve fast. Let's start with access, the front door of the patient experience. In the past, scheduling an appointment meant calling during business hours, waiting on hold, and hoping for an opening. Now, technology is bringing on demand access. Online portals, mobile apps, and even voice assistants are making it possible to book, reschedule, or check in with just a few taps. Retail figured this out years ago. Remove friction, empower the customer. Healthcare is finally following the suit because convenience isn't a luxury anymore. It's the new baseline. The second transformation that we want to talk about is personalization. Retail and aviation thrive on data. They analyze every click, every mile flown, every preference, and then use that data to tailor experiences that feel personal and proactive. In healthcare, we are starting to see that same mindset take a hold. Wearables, remote monitoring, and EHR integrated AI tools are generating a constant stream of data. Your blood pressure, your heart rate, glucose levels, even your sleep patterns. When that data is analyzed intelligently, it allows care teams to anticipate patient needs instead of just reacting to symptoms. Now let's just imagine receiving a message from your care team saying, "Hey, we noticed your activity dropped this week. How are you feeling?" That's not science fiction anymore. It's the healthcare version of the airline telling you your gate has changed even before you ask. But personalization also raises a tough question. How do we balance innovation with privacy? Patients want convenience, but they also want control. The best system, like in aviation or retail, are transparent about how they use data and give customers choices. Healthcare has to build that same trust because, let's be honest, without it, technology becomes a wall, not a bridge. Now, let's talk about experience design, something healthcare can learn directly from aviation. Think about it. When you travel, every touch point, from check-in to onboarding, is designed to move you through the journey efficiently. The systems talk to each other. The staff have access to the same information. The experience feels coordinated. Now contrast that with the healthcare system. Patients fill out the forms multiple times. Systems don't always share records. You can see three specialists and still have to repeat your medical history. That's not a technology problem, it's an integration problem. And the organizations that solve it will win the loyalty and trust of their patients. We have seen glimpses of what's possible. Some health systems are now using predictive analytics to map patient journeys, just like airlines map passenger flows. They can identify bottlenecks, wait times, lab delays, communication gaps, and fix them in real time. Others are using digital command centers to track patient movement through the hospital the way air traffic control monitors planes. The result? Shorter waits, smoother transitions, and definitely better outcomes. But here's the deeper lesson from retail and aviation. Technology alone doesn't create great experiences. Culture does. Amazon didn't become customer obsessed because it had good data. It became good at data because it was customer obsessed. Delta didn't digitize to cut cost. It digitized to make flying easier, faster, and more predictable. Healthcare leaders have to make the same mental shift from compliance to experience, from process to empathy. Technology is the enabler, not the destination. And let's not forget the workforce. When we talk about technology, we often focus on patients. But the clinician experience matters just as much. A nurse juggling 3 platforms and 10 alerts isn't more efficient, they are more exhausted. The best systems, again, let's just think of aviation, invest in human centered design. The tech simplifies work, it doesn't add to it. Healthcare is finally beginning to follow that path. AI driven documentation, virtual scribes, automated care coordination. These tools can give back time to the clinicians so that they can focus on what matters: people. And speaking of people, let's just talk about trust. In retail, trust is built through reliability. In aviation, it's safety. In healthcare, it's both and even some more. When patients share their data, they're sharing their lives. So, the organizations that will thrive in this new era are the ones that treat data not just as a resource to be mined, but as a relationship to be honored. That's the next competitive advantage: ethical experience design. So, what does the future look like? I personally see 3 big trends shaping the next phase of patient experience. First, predictive care will become mainstream. Like AI and connected devices will spot risks even before symptoms appear, from early heart failure detection to mental health relapse alerts. Second, frictionless access will become universal. Every patient will expect healthcare to work like online shopping: simple, seamless, 24/7. And finally, experience alignment, where every part of the system from billing to bedside feels connected and human centered. That's when technology stops being an add on and becomes the invisible thread holding everything together. Let's be clear, this won't be easy. Healthcare isn't retail. It's more complex, more regulated, and far more consequential. And Ron, you have been in healthcare for so long, you probably know this. Agreed. But the mindset shift is the same. Design around the person, not the process. If aviation can move millions safely every day, With predictive systems and coordinated data, healthcare can absolutely learn to do the same for the patients. So, here's the takeaway for leaders: don't just digitize, humanize. Technology should make care more personal, not less. The goal isn't to make healthcare more efficient, it's to make it more connected. And if you can blend empathy with innovation, you'll not only improve satisfaction, but you will redefine what good care feels like. So, as we close today's episode of the Health Boardroom, I'll leave you with this. Technology is transforming healthcare, but experience will define its future. When we borrow the best lessons from retail and aviation, we move from a system of encounters to a system of relationships. And that's how healthcare becomes not just smarter, but truly human again. So, thanks for listening. If you found this episode valuable, share it with a colleague or a friend who's passionate about patient experience and innovation. And don't forget to subscribe, because next time we'll explore how AI is changing the economics of healthcare delivery, from hospital operations to payer strategy. Until then, stay thoughtful, stay curious, and keep reimagining what healthcare can be. I'm Ron, and this is the Health Boardroom.